Please. Remember that? The MD program. And it was all these companies with adjacent offerings, maybe like Q, this thing that would make a given function of a practice go better.
Yeah.
Why don't we text our freaking bills instead of send these ridiculous pieces of paper that no one reads? That concept opened my eyes to just how closed AthenaNet was to outside development. And, I tried very hard to open it up. And, one of the many great reasons for firing me was how much money I spent trying to open it up when I could have been shipping the profits. But that idea of all these companies wanting to connect and engage in some way in collaborative products delivery kind of got me excited. And then watching over the course of the pandemic, this new flavor of company that sort of makes its own tech, but also delivers care, right? It doesn't sell tech to providers. It is a provider, but it also has a CTO and an engineering team and designers, and they're designing workflows, apps, and services. That concept of hybridizing the tech and the care into one animal really excites me. But I happen to know how long a putt it is to build a fully functional EHR. And the idea of each one of these, I do nothing but, irritable bowel syndrome, and I do it better than anyone. And I've got my own tech team, and I've got my own dedicated coaches and GI docs. But anyway, like HIPAA freaking compliant, meaningful use freaking compliant prescription writing is just a lot of work. And it's not going to make us any more unique as a treater of irritable bowel than using someone else's. Whereas if I'm stuck, frankly, using AthenaNet or Cerner or Epic or whatever, which is really designed for an office-based encounter with a provider who's not building any tech, that's tough too. And so I think the idea for Zus was, what if we help these guys thread the needle? What if we pre-built a lot of the basic activities? Registration, like everybody's got to build patient registration, right? Prescribing or building a care plan. Like, what's a care plan? Well, it's a bunch of tasks. Okay. Building a task. These things are common across the vast majority of these 8,000 new digital health companies that have come into being and gotten so much venture capital in the last couple of years that we could speed up the category, not just, make a couple of great bets and win as an angel investor, as I was trying to do before, but actually speed up the whole digital health category if we could make those core utilities available to everyone. Super cheap, super good, super performant.